Good morning. My name is Pedro Bernaldez. I am orthopedic surgeon and director of SportMe Medical Center in Seville, Spain. It's an honor for me to participate this year in TOBI 2021, thanks to Steven and all his team. My conference is Bridging the Gap Between Surgical and Conservative Treatment, the SUBA protocol. It's a simple speech, nothing new for you probably, but that collects the work and professional reflection of more than 20 years of experience as an orthopedic surgeon. Those are my disclosures. The working hypothesis, we consider that in some pathologies where surgical treatment is generally indicated, we should first try an alternative treatment where the patient doesn't necessarily have to undergo surgery. I am orthopedic surgeon and my great passion is obviously surgery, but what I do less and less is to operate, and over the years, even less. Patients consult for pain and loss of functionality, and we must return to the patient to the functionality with symptomatic relief of pain in the less traumatic way and with less morbidity and cost possible. This article, published in 2015 by Lohmander, impressed me by the conclusion. About 80% of common orthopedic surgeries don't have adequate evidence of efficacy. Really amazing for me, like an orthopedic surgeon. This year, in 2021, Blom has just published a similar article in the British Medical Journal, Common Elective Orthopedic Procedure and Their Clinical Effectiveness, and he showed the 10 most frequently surgical pathologies in orthopedic surgery and their evidence. How many of them present level of evidence grade 1 with respect to placebo control group? And again, it's surprised that only one, the carpal tunnel release surgery, obtains an evidence, being the other remains once questionable. I understand that the community of orthopedic surgeons must consider this data and ask ourselves many questions in order to provide the best medical care to our patients. With all of this, we want to put on the table that perhaps there are a number of surgical indications that could be considered, and this is basic for our work and the creation of the SUBA protocol. But first, I would like to make 3 reflections. First, the key to success is the correct indications, and this is only given by an adequate diagnostic. The second reflection, to know what a patient has, all we need is chair and time. And the third is double reflection, primum non nocere of Hippocrates, and the art of the medicine consists of amusing the patient while nature cures the disease. SUBA protocol or philosophy are 4 letters: sport medicine, ultrasound, biologic, and arthroscopy. It's very similar to the philosophy of interventional orthopedic of Dr. Centeno. Now is interventional orthobiologic. Classic orthopedic surgeon image is equal to the function. But for us, it's more important the functionality of the joint than the specific X-ray or MRI. I usually say in the clinic, we don't treat resonance, we treat patients. We start the first letter is of sport medicine, where we give great importance to factors such as neuromuscular function, the axis of the limb, is there any asymmetries or dysmetries in the joint, biomechanic, overweight, clinical situation, emotional situation, psychological, mechanical versus inflammatory condition. It's very similar to Dr. Centeno's SANS, stability, neuromuscular, symmetry, or articulation. We need to find the diagnostic as soon as possible and in the most optimal way. Early treatment of the injury with a functional recovery program and return to sport school. We have to educate the patient, promote physical activity, injury prevention, postural education and ergonomics, facilitation clinical guides, exercise sheet, tutorials. The second letter is U for ultrasound. The entry of MSK ultrasound in the clinic of orthopedic surgeon has been a real medical revolution, both for being able to diagnose it in the real time as for the fact of being able to start treatment in the same office, a before and an after. The advantage of use MSK in orthopedic surgery, there is a lot: accessibility, no radiation, easy handling, involvement of the patient. They allow comparison with the anatomical structure of the contralateral limb, precise study of muscle, ligament, tendon, neurovascular, single atom resolution, cost reduction, and use guide therapies and surgery. Here you are, all the indication we can see with ultrasound. Use guide therapies, high average of blind infiltration, don't go to the right side. Painless, fast, economical, and safe technique. Specific infiltration according to the pathology. Here you are, many pathologies in different joints that you can directly to do a use guide therapy. You can see hip, knee, elbow. The third letter is B of biological. Without doubt, in the last 15 years, the development and the application of biological therapies with plant-rich platelets, BMAC or stem cells, are achieving the healing of the different tissues of the locomotor system, and it's for the reason that pathologies that before we indicate for surgery, now, thanks to the biological therapies, are regenerated or healing. We present our protocol of biological therapies. It's also important to follow some kind of classification or so-called peer-paid a la carte, thanks to the data Biologic, to use the same classification. In our case, 24, 00, and 11 is the usual one, that is to say, we concentrate the platelet population +2 with respect to the blood. We don't use red blood or leukocyte. We activate the plants with calcium chloride. In this amazing infographic, Dr. Centeno presents all the randomized double-blind and controlled trial that evidence the thickness of platelet-rich plasma compared to the other treatments such as hyaluronic acid, steroids, surgery, infiltration with placebo, exercise, or dry needle. Even surgeons with great prestige worldwide, like my colleague Dr. Cole, with a huge surgical volume, are changing their mentality by incorporating these therapies as the first line of therapies to treat numerous MCK pathologies. The fourth and last letter is an A for arthroscopy. Consider that if surgery is necessary, it should be minimally invasive or arthroscopy and even ultrasound-assisted surgery, due to its numerous advantages in anatomical repair in the postoperative period and at cosmetics level. Conclusion, we confirm the hypothesis. After more than 10 years of work applying this new philosophy, the number of surgical indications in our team, more than 20 indications, has been drastically reduced, achieving satisfactory results, minimizing the number of complications, and improving the patient expectation, which does not mean that there are and will always be numerous indications for surgical treatment in injuries of MCK system. Why to operate less? Message for home. Surgery doesn't solve all the pathology. 2, the key to success is the correct indication, and this is only given by an adequate diagnostic. 3, applying the basis of SUBA protocol, we consider a lower number of surgical indications. It will be possible. I continue operation an important volume of patients, but perhaps with greater criteria which offer me better results in the long run. 4, the use-guided and biological therapies solve many pathologies that before I used to go through the operation room directly. And 5, if surgery is required, minimal invasive or arthroscopy surgery is preferable. In conclusion, the more SUBA I do, the less I operate. Before, we do a conservative treatment and then surgery. Now we include the SUBA protocol. We have tried to organize sites and present several concepts as a protocol or philosophy for those of us who are dedicated to the care of injury of the MCK system. In our experience, applying all these principles in a systematized and ordered manner has helped us to achieve better clinical results and greater patient satisfaction. Thank you very much. See you in Seville the next year, and thank you very much.